But welcome to this week's Hazards Campaign Thursday talk. Breast cancer awareness is not enough. My name is Janet Newsham, and I'm the chair of the National Hazards Campaign, which is a campaigning organisation on occupational health and safety issues, and it's a UK-wide network of campaigners with a long history of calling out injustices at work. We've been putting all our recordings on the Hazards Campaign website, and we'll send around the link afterwards when I've managed to upload it all and edit it maybe as well. But please look at the other recordings. You might find them quite interesting. We've done quite a lot of Zoom meetings on different aspects of COVID-19, and this is really nice to do something else tonight. So tonight we've got a fabulous lineup of speakers and plenty of time to discuss the important issues that we're going to hear about and actually look at some actions that we can take forward. So our speakers tonight are Helen Lynn, who's a health and environment, she's healthy, I'm sure. She's a health and environment researcher from London, involved in researching environment and occupational risks for breast and other cancers. She's a founder member of a campaign which has got a fabulous name, From Pink to Prevention, and a great friend of the Hazards Campaign, and we're privileged to have her to talk to us this evening. We've also got Jane McArthur here, who's a doctor fellow in sociology and social justice at the University of Windsor in Canada. So fantastic to have an international speaker coming to us with all our lovely weather in the background. So our work is rooted in community-based health investigations with a view to prevention. Both are world-renowned experts in their field and thoroughly nice women as well. Which leads me to Jane Stewart, a wonderful woman from Birkenhead, where she works at Port Sunlight at Unilever, and she's done so for the past 30 odd years. I've known Jane for maybe at least 3 decades. She's a fearless trade union activist and representative and a convener at her side, and sits on the TUC General Council and chairs the National Women's Committee in Unite. So the subject tonight is breast cancer awareness is not enough, and I can't think of any other women more appropriate to discuss this issue. 30 years ago, just over 30 years ago, my mum died from breast cancer. It's haunted me personally from then, but it's also other friends and colleagues who died or who have recovered from this awful disease. I've come to understand that for many of these women, it was never an accident of fate because of a toxic combination of environmental and occupational factors, ones that they probably knew nothing about. So tonight we want to change that. We want to increase awareness and we want to look at actions to stop many of these preventable diseases affecting women. And our first speaker I'd like to welcome is Jane McArthur. Thank you, Jane.
Thank you, Janet, and thank you to all of you for inviting me to be a part of this talk tonight. I'm very honored and privileged to be able to be considered knowledgeable enough. I can tell you I come with passion about the issue, and I'm so inspired by all those who have taught me so many things, including many of you. So as Janet said, I'm a doctoral researcher in sociology and social justice at the University of Windsor in Ontario, Canada. And I'm a qualitative researcher, which means I collect people's stories, and then I tell those stories through the lens of my research. And I believe stories, alongside the knowledge we get from sciences and more, are critical pieces of the strategies that we need to address breast cancer. The stories that I'll share today, I think, make it clear why awareness raising as a breast cancer strategy has significant gaps. But by using the words of the women in my dissertation study, I'll show how those gaps create spaces of opportunity. Next slide. Dr. Ted Shetler, who wrote The Ecology of Breast Cancer, said, breast cancer is not only a disease of abnormal cells, but also of communities we create and live in. I often quote this because I think it's such a powerful statement. To me, what it says is that we can create the communities where we reduce or eliminate risks for breast cancer. This statement also underscores the theme for tonight's talk. Awareness is not enough. We also need to create. We need to pay attention to the science and listen to the women and workers who have intimate knowledge of their risks and the places where those risks are present. We need to intervene in those places using multi-level strategies to create safer, healthier environments to achieve primary prevention of breast cancer. We know that numbers of chemicals that are known or suspected carcinogens are growing, and that breast cancer incidence is rising, particularly in younger women. We know there are reduced rates of survival for breast cancer patients exposed to fine particulate matter air pollution. And we also know that certain occupations bear a higher risk for breast cancer. We know that specific groups of women are at greater risk of dying of breast cancer because of social and structural factors. We also know that policies that have been adopted that reduce industry use of carcinogens lead to a decline in releases of chemicals reduced to cancer. So all of this knowledge gives us a basis to begin the creation of effective breast cancer prevention policies. Next slide. Worldwide, 630,000 women died from breast cancer last year. Commonly known risk factors for breast cancer include diet, nutrition, exercise, alcohol, family history, and hormonal factors. About 5 to 10% of cases are related to genetics, but there's a big gap in that list. What's missing there is the role of risk factors in our environments, including our work environments. 70 to 90% of breast cancers may be linked to those environmental influences. Research identifies over 200 chemicals that may increase breast cancer risk and links air pollution, organic solvents, chemicals in workplaces, and some consumer products to breast cancer. Most cancers arrive from multiple causes, which is why scientists talk about the causal webs of cancer. This idea points us to the interactions between factors that might lead to the development of breast cancer. And that's a really crucial piece of knowledge in the work we need to do moving forward on breast cancer. And it's a piece that breast cancer awareness campaigns fail to communicate. Next slide. As a sociologist, I look at the social world. Environmental breast cancer research shows us that health is not just a medical issue. The socio-ecological model of health represented here illustrates how health is intertwined and impacted by factors in the social world and our multiple interacting environments. People live within families, communities, ecosystems, and planetary level conditions. The health of any part of this nested set of relationships depends on the interactions between them. Awareness, with a focus on personal behaviors, as so many breast cancer campaigns advocate, cannot alone sufficiently address these environmental risks. Next slide. Awareness does serve as a purpose, but the content of the messaging matters. Media are an important source of health information for women. Media coverage of breast cancer tends to focus on prevalence, detection, treatments, breakthroughs, and cures. But there is a lack of environmental, occupational, and primary prevention-oriented stories. The ways that health and risk are framed in the media affect regulations, legal decisions, and research and development directions. Media messaging also helps shape and shift women's perceptions. Information from medical sources, cancer agencies, doctors, employers also matter. The Silent Spring Institute, which is a research organization dedicated to breast cancer and environmental exposures, recently published a study that found that less than half of cancer organizations include information on environmental chemicals on their websites. Our awareness of breast cancer must be expanded to include occupational and environmental risks. Breast cancer experts and cancer organizations should communicate the science on environmental factors in their work to enable targeted primary prevention strategies. Next slide. In keeping with the idea that the messages matter, my dissertation research project investigated women's narratives for their understandings and knowledge of breast cancer risks. My project's central questions were, how do women who work in an environment with identified risk for breast cancer construct narratives and understandings of breast cancer risks? How do they place environment in those narratives or stories? And how do they perceive and exercise agency or action in the context of their risks? I chose to interview women workers at the Ambassador Bridge because of an alleged cluster of breast cancer among the workers there and the pursuit of compensation for one of the women diagnosed. Next slide. The Ambassador Bridge is the busiest border crossing in North America, with over 20,000 transport trucks and other vehicles crossing each day. The bridge environment contains high levels of air pollution and exposures to identified breast carcinogens. A recently published paper found that women at the bridge are being diagnosed with breast cancer at rates 16 times higher than the rest of the county. Next slide. When I interviewed the women at the bridge, they named genetics and lifestyle factors as risk for breast cancer, but they also named diesel truck fumes, chemical exposures, radiation, and working conditions generally. Women with breast cancer wondered if these exposures contributed to their diagnoses, but noted that doctors and their oncologists don't ask about their work environments. They suspected the environment contributed to the many breast cancer cases among them, but their suspicions, based on their observations and experiences, conflicted with knowledge from doctors, media, their social networks. And their employers' responses to their concerns were downplayed and even ignored. Women talked about trying to balance their workplace exposures by controlling things like diet and exercise, but they felt in many ways that controlling their risks was out of their hands, especially at work. There's a culture of mistrust at the bridge. Lily, who I interviewed, distrusts the results of air quality testing, saying, "I have to wonder, when did they do the study? On a Sunday when there were no trucks?" She connects her doubt with the number of breast cancer cases, referring to a conversation with another coworker who told her that in a matter of 3 years, there were 18 women diagnosed with breast cancer. One of the women I interviewed told me she knew of 30 women who were diagnosed with breast cancer, which is about 30% of the female workforce. Samantha talked about breast cancer risk at the bridge as a question of values, asking, what do we value? Do we value women's health, and how much? I think that's where you would find that the trade needs and pushing those trucks, pushing those cars, as we call it at work, is going to end up feeling more important to decision makers or the power players than protecting women from risk. Samantha also highlighted how economic and political influences play a part, saying, because of the power of the lobby of the truck traffic, we get torn in two directions on this. This is the industry that defines our area. So when you were talking about limiting environmental pollution, you're talking about limiting the trucks that deliver the different types of parts, which then limits the jobs of those workers who need those parts to build the vehicles. Samantha then asked, can we not redefine these businesses in a less harmful way? When we talk about reducing the harmful effect of traffic, what you are really talking about is redefining the whole trade relationship with every other country in the world. So it's a tricky question, and I think it feels very much out of our hands, which is another reason why I think it becomes easy to shelve it, because the question is too big and you feel too powerless. Lorraine told me, I think we all know diesel fumes and poor air quality is there. It's just, what can you do about it? Not too much. The port is going to run. I don't know what the solution is there, but it's definitely something that has gotten worse over the years. I think a lot more people are getting sick. And Lily firmly told me they have to be able to make revisions so there is more protection. The women talked about possibilities of creating protective strategies through their union. Cindy said, we have a health and safety committee that is made up of the union and management, and that is the way to go because the people in that committee have standing with management. And Lorraine said, where we understand the consequences of our health because of these environmental factors, that is something the union would be able to work with. But even the avenue of the union and the Health and Safety Committee produced barriers to action that the women felt needed to be overcome. Sophia Bell said, unions have to be far more proactive in getting involved, and I believe they are. The women expressed to me that their union, employer, governments, and compensation board all hold some kind of responsibility for their risks for breast cancer. And Jackie said, there's a definite obligation to make sure people are in a healthy and safe work environment. Larissa was optimistic, saying, I am hoping if these risk factors are being shown to be an issue here, that we can be the catalyst that helps everyone. Next slide. The women's stories and the knowledge of the specifics of their workplace and other environments show us that awareness raising and the focus on individual level choices is not enough. The women at the bridge provided workplace level strategies, but they also talked about the broader systems of transportation, trade, and economies. The systems model of health, shown here, shows us that multiple interacting environments contributing to breast cancer are contributing to breast cancer development. So policies, regulation, legislation, and interventions can be directed at the technological, built, food and agriculture, chemical, socioeconomic, psychosocial, and global environments. These are all the spaces that we live in, work in, and interact in our daily lives. The opportunities for interventions that lead to prevention are possible if we take the knowledge of the science and of the workers who intimately know their workplaces and practices and create collaborative and multi-level interventions. Next slide. The omission of environment and occupation in messaging about breast cancer and the corresponding inadequate protective and preventive action are environmental justice issues. Focusing on preventing breast cancer through lifestyle choices ignores the fact that we don't all share equal access to the same lifestyle. The individual lifestyle focus loses sight of social justice issues that limit access. Thinking about breast cancer risks in our environments inevitably leads us to bigger questions of our understandings and actions on feminism, gender, equality, and intersectionality. In my research, the women named their breast cancer experiences as they produce their stories that imagine social justice through systemic changes. Next slide. Awareness raising alone is an ineffective solution to the breast cancer epidemic. We need action on primary prevention to limit exposures to known and suspected breast carcinogens. When we know women are being exposed to identified breast carcinogens in their workplaces, we can and should reduce or eliminate these exposures to prevent breast cancer. When we know there are endocrine disrupting chemicals in personal care products, which are associated with an elevated risk for breast cancer, we can and should eliminate or replace these substances. When science tells us that women exposed to high levels of air pollution, especially vehicle exhaust, are at a higher risk of developing premenopausal breast cancer, we can and should put controls on pollutants or develop alternatives. When we know there are disparities in breast cancer incidence and survival across some groups of women, we need to address the social determinants of health in our strategies to mitigate risk and to prevent the disease. Many environmental and workplace exposures are outside of the control of individual women. They are involuntary exposures, not modifiable with lifestyle or behavior changes. Socio-ecological understandings of health point us to the root risk factors for breast cancer. The women at the bridge recognize they can't address breast cancer on their own. They need support and collaboration from their union, their employer, the community, researchers, and governments. Breast cancer is a design problem. To prevent breast cancer in the future, we need fundamental change around what we value and how we view health. Ecological prevention strategies involve society and individuals collaborating to promote the principles of public health, to clean up and protect the environment, end poverty, violence, and discrimination in all their forms, while providing resources in communities that support sustainable jobs, housing, education, healthy food, healthcare, civil engagement, and importantly, ongoing research into occupational and environmental links to breast cancer. Increased understanding and collaborative partnerships between medical science and social science could improve breast cancer prevention strategies, particularly where risks are involuntary. The way women understand breast cancer risk is dynamic, contextualized, multi-sectoral, and offers insights into understanding the spaces where risk is present. As seen from women's standpoint, breast cancer risk is not just a biomedical phenomenon residing in the body determined by genetics or lifestyle choices, but it is experienced by women in a nested set of social, cultural, and political relationships. Dominant biomedical narratives obscure the experience of women, including the spaces they identify breast cancer risks. But women are important knowledge producers and interpreters, and they should be included as partners and collaborators in public health and breast cancer prevention strategies. We need to move the story of environmental breast cancer from the margins of awareness into the open spaces and fill in the gaps on breast cancer by making critical interventions at all systems levels. We need a policy agenda with a socio-ecological approach that addresses systemic supports needed for individual and population health. This would transform health and care for women, men, and children alike, and the environment of finite resources that is our planet Earth. Thank you.
Brilliant.
Thank you so much, Jane. That was fantastic. And I think, where you contextualize that in the, from the research that you did with the Ambassador Bridge research. And I thought that was really interesting, to hear the voices of the women, because in that sort of environment, like in many of our workplaces, they would be able to tell you the concerns that they had, but maybe not be able to deal with it, without the knowledge to deal with it. And I think, when you were talking about how breast cancer has been sort of individualized, and it's about individual risks rather than about the collective, we need that collective collaborative approach to it. And I think that's somewhere where perhaps Jane in a minute can talk about, so from a trade union perspective, the sorts of things that we can do to start to challenge that. But thanks very much for that, and putting it into that perspective. So our next speaker is Lynn. Gosh, it's Helen Lynn. Sorry, Helen, who I said before is a fantastic friend of the Hazards campaign, and we're really lucky to have you, Helen. So over to you, and I'll find you your presentation.
Thank you. Thanks very much for inviting me to speak, especially alongside such inspiring women working on the issue. That was great, Jane. Really, really interesting. Yeah, I'm sure there'll be lots of questions. Are we doing questions at the end? Yeah.
Yes.
Okay. So just first slide, just the anyway.
Oh, sorry.
Yeah, it's all right. Okay, so just to say that, yeah, the title of the presentation today was Breast Cancer Awareness Not Enough. And so I kind of considered why we need to move from awareness to prevention. And I am a campaigner and researcher, and my work focuses on women, health and the environment. And by environment, I mean all environments, our living environment, our working environment, but also our first environment, which is the womb. And I think the COVID-19 crisis is shining a very harsh light on public health, which has been sidelined for years, really, and also on the multiple inequalities which have contributed to decades of illness and disease. While there is poverty and inequality, we cannot have public health, proper public health, and this also applies to the cancer epidemic. Next slide, please. And just we must never forget that there are lives behind every statistic, and that breast cancer is the most common cancer in UK women, with 55,176 cases of women diagnosed and 390 men each year. That's 150 a day. And the death rate, 11,400 women and 85 men per year, and that's 31 women die from breast cancer each and every day. And it's the fourth most common cause of death and the leading cause of death in women under 50, which kind of makes a nonsense of the fact that they say it's an older woman's disease. Also, there are about 35,000 people living with secondary breast cancer in the UK, and this is the thing that kills women. Probably not breast cancer itself, but secondaries transmitting to different organs and into the spine and liver and so on and so forth. Breast cancer deaths in England are most common in females living in the most deprived areas, and the ethnic variations, the stats are really bad on this, but patients known to be Black are younger and less likely to be screen detected and have a worse prognosis for their tumours than their white counterparts. And in around 5% of women, breast cancer has already spread by the time it is diagnosed. And in the last 25 years, the UK rates have gone from 1 in 12 to 1 in 7. That's the rate, the risk factor for breast cancer in a woman's lifetime. But despite all these growing numbers, each and every October, which is Breast Cancer Awareness Month, we are treated to this festival of pink. Next slide, please. So you can get pink cars, pink motorbikes, pink toys, pink stun guns, cranes, crutches, pink drinks, golf balls, Scrabble, bullets and guns, and also fracking drill bits and trailers. It really goes from the sublime to the ridiculous. And companies are actually falling over themselves to provide these pink products aimed at raising money for breast cancer. And this is what we call pinkwashing, as ironically many of these products sold contain ingredients or are manufactured from chemicals that are linked to breast cancer, such as ingredients in plastics, ingredients in cosmetics and cleaning products, or petrochemicals in cars and contaminated fracking fluids. So in reality, the sums raised are minuscule and they do nothing to stem the rising cases of the disease. And we need to focus more on this and actually follow the money and question how much is raised and how it is spent. Next slide, please. Because breast cancer is not a rite of passage and should not become a rite of passage for women. Men get breast cancer too, but in far, far smaller numbers, fewer numbers than women. And as Jane's already said, it is a social justice issue, a human rights issue, and it's an indication of the state of our environment, all environments. If we have breast cancer, then we have polluted environments, and we really need to think about and move to cleaning them up. And when I was thinking about this session, I was thinking that it's time to reframe how we look at breast cancer. And breast cancer can be considered an act of violence if we consider violence to be as defined by the World Health Organization. And that is the intentional use of physical force or power, threatening or actual against oneself, another person, or against a group or community, which either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. And next slide, please. So we could view the involuntary occupational environmental exposures as an act of violence, and this might actually increase the urgency with which we need to deal with the rising cases. Because we are unwittingly exposed to multiple risk factors on a daily basis, and currently occupational and environmental risk factors are not considered adequately or at all in any cancer plan or strategy. And as Jane said as well, the cancer establishment has been addressing the so-called lifestyle risk factors for the last 50 odd years, and they are diet, alcohol, lack of exercise. And there's been very little progress on breast cancer, on reducing breast cancer cases and the death rates which continue to rise, although we know that there has been some improvement in survival rates. And to actually borrow a European term, we need to refit our cancer plans for the 21st century so that they address 21st century exposures in 21st century settings. And the breast cancer prevention partners in the USA have recently released a report called Paths to Prevention, the Californian Breast Cancer Primary Prevention Plan, which could be replicated here and in other parts of the world. And almost all the risk factors they found are linked not only to our living environment, but also to our work environment as well. Yet the breast cancer establishment has been focusing on the up to 30 to 50% of cases thought to be linked to lifestyle risk factors. And this has been to the exclusion of other risk factors, i.e. occupational and environmental exposures. But we know that breast cancer is a multifactorial disease, so all the other risk factors impact on the so-called lifestyle risk factors. They do not exist in a vacuum, as neither do we. Next slide, please. And the breast cancer prevention partners also have a really neat diagram which considers the complexity of the breast cancer risk factors and the science to support them. And we see that each factor affects the other. And so this is why it is really important that we address all the risk factors if we are ever to see a reduction in cases, especially for women. Next slide, please. And there's pretty good research to support links between certain occupational exposures in certain occupations and breast cancer, yet very few of these chemicals are regulated in the workplace. So although trade unions are doing a really good job addressing the needs of those returning to work with cancer and working to maintain health, they are also in a position of being the best place organisations capable of addressing the environmental and occupational risk factors. And these risk factors can be caused by a variety of things, but mainly by lack of enforcement of poor regulations made by legislators who fail to consider sex, race, or social economic factors. It's almost like they don't care. Cancer is also caused by lack of political will. There is underestimation of cases, ignoring of the evidence, lack of data broken down by gender or ethnicity or race, and lack of compliance with the existing regulations. And this is all tied up in a big bow with vested interests, which is a whole other ball game and probably required another webinar to deal with that. Next slide, please. Now, women are not the default male, and they're particularly affected because we have a lifetime of hormonal changes, i.e. pregnancy, menstruation, menopause, puberty as well. We have different immune systems. We are more prone to autoimmune disease, and women make up 80% of those affected by autoimmune disease. We have thinner skin, so this may allow greater absorption of chemicals. We also detox more slowly. We've got more fat tissue, which allows greater storage of more fat-soluble toxic chemicals. And we're also affected differently by chemicals and pollution. For example, again, as Jane said, denser breast tissue is found in women living in cities, and denser breast tissue is linked to a greater risk of breast cancer. And this is thought to be linked to the pollution. We're also smaller than men. So sex differences are found in almost every system in the body, and compounding this, women are more likely to be in poorly paid, less regulated work, more likely to be affected by nighttime shift work and light at night. So we've got this triple jeopardy facing women: exposures in the home, exposures at work, and exposures in the workplace. So this all points to the fact that current regulations are failing women and men. And next slide, please. When it comes to pregnancy, occupational cancer exposures can happen in the womb before current health and safety measures are implemented. And this could be setting the fetus up for illness and disease later in life, including breast and other cancer, if there's no protection in place for mothers, certainly in the first 3 months of pregnancy, and even before a woman gets pregnant in the first place. Next slide, please. So what's needed? Well, whatever you're going to call it, we need to reframe, redo, refit our approach to breast cancer. And we need a three-pronged approach. So equal footing, equal funding, equal action on treatment and care, safer detection and primary prevention. And we need an aim really of zero occupational and environmental cancer, and a complete refit of existing cancer plans so that strategies are updated for these 21st century exposures and 21st century risk factors. If we look at spending on research into primary prevention, it's less than 5%. This needs to be bumped up to at least 35%. And the medical establishment could lead the way really by providing up-to-date training on recognising occupational and environmental illness and disease, including pesticide poisonings, especially in areas where exposure is most likely. And all the research data needs to be collected and broken down by sex, race and ethnicity. In this era of Brexit, I think the UK needs to follow the EU, the European Union, on chemical strategy for sustainability, which is actually considering such things as essential use to limit hazardous substances in products, toxic-free hierarchy, which prioritizes the design of safe and sustainable chemicals, extension of risk assessment beyond CMRs, which is carcinogenic, mutagenic, and reproductive toxicants, to consider such things as endocrine disrupting chemicals, legally binding identification of EDCs beyond the current regulations on pesticides, and an aim to ban EDCs from all consumer products, which would be wonderful. But the devil is going to be in the detail on this. But there is no reason why the UK can't aim to replicate this, or even, God forbid, aim higher. But primarily, we need to put the public back into public health and start from the premise that safe and healthy working conditions are a human right. Thanks very much.
Thank you so much, Helen. That was really interesting. And I like your premise about changing the whole, reframing the whole thing about breast cancer and saying, you know, it's an act of violence. And I think if you frame it in that way, then our response will determine something a bit more different, a bit more urgent, I think, and then increase perhaps our action against what's happening. And I think, you know, you're absolutely right that we have to relook at the whole way that we review, we regard breast cancer. You know, that it is something that has to be addressed. It has to be addressed from an occupational and environmental position, rather than, and again, what Jane was talking about earlier about an individual position. So thanks very much for that, Helen. Yeah, I should have said at the beginning, what we're going to do is take all the speakers and then we can open it up for discussion and questions afterwards. So thanks so much for that inspirational speech. Our final speaker tonight is Jane Stewart, who I've introduced before, who works at Unilever. So she works in a chemical company, an activist, a scientist, and hopefully is going to give us a trade union perspective on breast cancer. So over to you, Jane. Jane, you're on mute.
I thought you were unmuting me. Thought you'd gagged me, Janice. Sorry. Yes, so I'm Jane Stewart, and as Janet said, I've worked at Unilever as an apprentice, from apprenticeship up to retirement, because I'm pushing that button quite soon, I hope. When Janet rang me last week and asked me if I'd do this, I thought my first instinct was to say no, because I don't know enough about it. And she said, well, don't worry, because you've got two fantastic experts, Helen and Jane, and they'll come on before you and tell you all the good stuff. So, you know, thanks for that, girls, because I don't know what to say now, because you've covered it all brilliantly. So I'm just going to look at this from my own experiences as a shop steward and a safety rep, of how I would link into the campaign and work that you're trying to get the trade unions to engage in, and I think that's a must. So I started digging through materials that I had to hand, and I sent the links for them all. So we've got this women's working guide from Unite the Union, which Jan, I'm sure, will send to all the participants, and that gives you the guide to all sorts of women's health issues. Also, there's a little bit on breast cancer and cervical cancer in the forward, and all the different categorizations we look at of women's health within Unite. So it's a good guide, and it's a good source of finding how to operate in a workplace. And then the other thing I picked up, which was something that was we cover cabin crew in our union, and I remember a while back there being the cases taken through court because of the women from the British Airways were raising it, and that's another thing that I've sent out now, the occupational link of cabin crew people getting cancers, and lots of breast cancer in the women cabin crew. So I've dug that out as well, but I'm guessing our academics here will know all about that, but I certainly didn't know the detail till I read it, but I'm not going to presume to discuss any of that. So I dug through all this stuff and I read it and I thought, but still I'm struggling. So as a trade unionist, we campaign, we raise awareness and continue those campaigns. So the topic says, awareness is not enough, and it's not enough, but it's a good starting point and we do it really well. And I think Jane was talking about engaging with women, and I think if you start raising awareness about these subjects, it's a good engagement point. So I remember very early on in my career, in the early 80s, with our site at Ulster on at the time as well, and we engaged with the company, and we brought on cervical screening onto site because women weren't going for cervical screening tests, and there was a bit of that sheep immunity. If one person would go, all of the women would go, and it did actually work like that. But they also did breast screening, showing you how to feel for lumps and breast tumours and things. So that was something that I engaged in very early on. So it's always been playing in the background that it's an industrial issue, because out of that come, getting people time off for appointments, covering people when they're on the sick, all of those other things, but not so much looking at the work environment. And that's something that, needs to be done. And I work in the science area, so I sort of do it. As a matter of fact, you read your safety data sheets, you look for all your cost things, you look for those types of things. But so we then use those type of things to campaign. We would give plastic shower cards for instructions on how to examine your breast, all about raising awareness. But in raising awareness, you do get women talking, and I'll keep coming back to that. So we have to make it a workplace issue, and to do that, we have to do things like set up workshops. We need to map our areas. We do need to map our areas. We need to look at our areas, but we'll only know what type of illnesses that people are getting if they talk to us, because the company aren't going to say we've got 10 people up with breast cancer or we've got so many cases of this. We'll need to gather that type of information ourselves, and that's about trade union networking and organising and educating them. And I think that what we have done on our site, we've done like a menopause matters clinic, and I remember it was Janet very early on when I first met Janet, again back in the 80s, and she was on the EC in the women's seat at the time, and you talked about running those type of lunchtime drop-in sessions where you do a bit about today, whether it be Palestine or whether it be about something else, to raise people's awareness, women's rights issues and things like that. And Janet used to run those clinics, and it's something that stuck with me. So I've done that a lot. So I would do like a menopause matters talk from a trade union point of view about, getting air conditioning sorted out and fans, and don't be worrying about taking time off. So I think that's the sort of mapping we need to do and engagement we need to have with our workers, so we can put these campaigns together and direct things at the employer. I mean, where I work, you're talking about the cosmetic industry, and of course we make personal care products on our site, and I should know, but I don't know because I'm in the laundry area. what sort of issues are around that, but I'll certainly look into that. I do know that we use PCM-free perfumes in all of our products, including our laundry products, and that again, that they're something musks, which are synthetic musks that can cause carcinogenic effects, and they're also terrible things to get rid of in the environment. So we've removed all of them, or the perfume houses have removed them for us from the products that we use. And the other thing was deodorants. There's a lot of noise around deodorants because of the aerosol, because of the expellant that makes it a deodorant. But worse than that are the sticks, deodorant sticks. We took them off the shelves. We don't make them anymore. Roll-ons aren't too bad, but the actual deodorant sticks can actually the chemicals can get into your lymphatic system because of the weight. So we don't make them anymore, but you can still see them on the shelves. So there are all of those things, but you still don't associate that with your workplace. For some reason, you have a mental block on it, even though you know that your company that made them has stopped manufacturing them. You don't associate it with the ingredients you're working with. So I think there is a further education of workers about the environments they're in. And I think that the trade union has a great role to play in that. The price of health and safety is to be eternally vigilant. And it's about our safety everywhere in the environment, the pollution and everything that we come across every day, said Jane, who joined the meeting with a fag in her hand. But the practical ways we can help is raising it in our workplaces, mapping our workplaces, encouraging our members to come to us and tell us if they have any specific health conditions, particularly around breast cancer. This is what we're talking about now, so that we can actually map if there are areas where there are hot spots. And that's how we do it industrially. But I think more importantly is the socio-economic environment that we're living in and the pressures that are put on industry. So, you know, people that work in the nuclear industry, there's always a battle about moving away from nuclear energy. You know, I work in the petrochemical sector, so there's always a battle about going to green energy. We build cars in our union, well, not in the union, but our members build cars. So there's an argument about moving away from petrol, diesel cars and all of that. So there's always these conflicting capitalist arguments that keep coming around. So it is a political debate and discussion that we need to generate first and foremost in our workplaces, because that's where you will get momentum, and we need to know how to link that in to make the political map change to embrace these type of things that do in fact protect our health. And I like the terminology that it's an act of violence to put people at risk like that, because it is. And capitalism has blood on its talons. Even the nice capitalists like my company, they're still, you know, what do they call it? Friendly capitalists and things like that. But they're not really. They're all about profit before people. But they'll do just enough to stay on the good side of being that type of capitalist. And I think we just need to keep dragging them further and further to the good side, because profit can be made when people are healthy and well, as well as people being sick and downtrodden. And I think one of the really worrying things for the chemical industry in this country is the slashing of the provisions around when we move out, when we Brexit. We need to hold on to those European directives around chemicals. Otherwise, you know, we're on a hiding to nothing. As workers, we're on a hiding to nothing. And as a country, we'll be getting poisoned to death probably if we carry on stripping away at those things. So I think that the thing that I would like to do is maybe raise this through the trade union movement, put it back on the map about women's health being an issue. And, you know, and I noticed that Jane said earlier on about, you know, there is a battle to get through the health and safety committees to the company, because predominantly it's men that sit around the table. So I've got a big thing about, you must have women at those negotiating tables to raise the issues of our health because of our differences between men. You know, and the link between cervical cancer, I remember that was always about, quite often it's linked to women whose husbands are in manual trades, because they're bringing those toxins into the house where we're doing their laundry, where we're doing all of those things. So it's about thinking about, you know, you put those great circles up with all of the things that you don't consider as a workplace rep all of the time. And it's really good for me to sort of get that sort of chain of thought going again. Even though I'm meant to be a scientist, you just forget how to do that type of thing sometimes and link it all together. So I thought that was really helpful. So I suppose from a trade union point of view is, how can we help you? And we can't just throw money about it. We have to do campaigning work together. And I think the campaigning work for us would start in the workplace to develop those maps and things that we need to do, but also to take it through our structures. So we have it at our conferences, because what the trade union is good at, we're good at demonstrating, we're good at campaigning, and we're good at lobbying, and we're good at persuading people to move to places. So I think that that's what we do. I mean, we can do model motions through all our trade unions. We can get them up through women's conferences to the TUC and the boys' conference. I mean, I always remember the A Woman's Right to Choose. That was made an industrial issue when it was never ever discussed in industry, and that was made an industrial issue in the 70s. So let's look at women's health in the context of breast cancer and make it an industrial issue for next year, if that's possible, in the current constraints. And that's where I'd be heading with how we can move from just raising awareness to actually making a change in environment that can protect us all going forward. And I think that's all I've got to say about it.
I think that was brilliant. Thank you so much, Jane. Excellent. And I think you're absolutely right. The women have got to be at the table. They've got to be involved. And, you know, too often women have been excluded from all sorts of different committees and you know, kept into women's committees. But I think we've got to be at the negotiating tables. We've got to be there influencing the positions and making sure that, you know, in our unions, that we're active in our unions. We've got a slogan that women make great safety reps, and absolutely they need to be involved. And I think you've raised some really important, good ideas, you know, good, important ideas really as to how we can take the actions forward. So I'm going to open it up to the rest of the audience now to ask questions or make contributions. And, you know, really what we want to do at the end of this is to have a list of actions that we can take forward to actually start to drive behind this, you know, saying that it's an act of violence. So how do we address this act of violence towards women's health? Okay, so who wants to ask a question first? I don't know if you can raise your hand or put your video on and raise your hand if it's possible, because I can't see you necessarily. Wave, or just unmute yourself and ask a question. I think we can do that. Yes, Helen, do you want to come back on something? Oh, sorry.
There was some questions in the chat, just maybe.
Okay, let me have a look at the chat. So, does anybody want to just come in and ask a question that's posted something in the chat? Yeah, Kathy. You have to unmute yourself.
It's not one that I posted in the chat.
Okay.
Is that okay? Should I?
Yeah, no, that's fine.
Yeah. It was about what several of the speakers who are all great, thank you very much, said about public health. And I think at the moment, well, two things. Because of COVID, certainly in Scotland, I presume in the rest of the UK, there's been a real tension, which I think is reducing somewhat now, but certainly at the beginning there's a huge tension about, is this a public health issue or is this an occupational health and safety issue in the workplace? And at the beginning it was all, oh, it's a public health issue. The HSE was saying it's nothing to do with us, no, not quite, but almost, it's nothing to do with us, it's about public health. I think that is shifting now because there is a growing recognition that there is a lot of workplace transmission and that it is a health and safety issue as well as a public health one. So that's one point. But the second one is, I worked in the health service for almost 20 years and have been involved in health and safety for longer than that. And we have consistently tried to say public health should be much more upfront about talking about work. And so far we've been, and certainly in Scotland anyway, pretty unsuccessful on that. So, we've been saying, the public health messages shouldn't just be about lifestyle, about, road traffic, about whatever. They should be about work and health and what people should be able to expect at work and what the risks are and everything. And just recently, the Public Health Scotland has produced a new strategy, and it doesn't talk about work at all. So I'm just raising it partly to hear what the speakers have to say about that, but also partly to kind of, I suppose, say, how do we shift that? Because it's, even after COVID, you would think, we know that protecting workers is protecting the public, and yet it doesn't seem to be translating.
Thanks, Kathy. And I think, we're shouting all the time during the COVID, the fact that they're keeping workplaces out of the transmissions all the time, not even making them accountable for some of the clusters and and what's happening with the transmission rates. There was a question from Robert. So has there been any research on the causes of the worst outcomes of breast cancer tumours on Black women? And is it access to screening that's an issue? And there was another one I just picked up. About clarification about Unilever. Did they withdraw the stick deodorants because of aluminium, or just because of the sticks, or aluminium sticks, etc.?
Yeah, it's just because they were sticks. There was something in the delivery of a stick, that it was the paste that it took longer to absorb. You put more of it on, it absorbed more into your skin, blocked your lymph systems. That's why they took it out. It was nothing to do with aluminium salts. We didn't have them in there.
Okay, thanks for that clarification. So
I don't really know. I'm not very scientific. Sorry about that.
I'm building you up as a scientist here.
Well, I am a bit, but a bit rusty.
Jane or Helen, do you want to come back on the points that we made? So you have to unmute yourself.
I'll just maybe in a minor way address what Kathy was just saying. And I think, this is one of the things that has troubled me here in Canada through COVID, and especially in Ontario, which our province is, we've got a fairly large manufacturing sector. And so as we've watched COVID play out, and as you said, the idea that was framed as public health, but workers were being ignored, that the role of workers somewhat became elevated when they started to do this messaging around, heroicizing healthcare workers. But then once the data started to come out about healthcare workers and the lack of protections and the failure to provide proper PPE and the distinctions between the different healthcare workers and who was more important. And, in Ontario, we have, so personal support workers would be, kind of a lower, if you're ranking, which is a terrible thing to say, but personal support workers, for example, tend to be more often migrant women, immigrant women, racialized women, poorer women who are going between different facilities. And so they were at higher risk and they were contracting COVID. So this kind of brought some of this discussion out. And I actually tried to work on framing that in a piece that I wrote earlier this summer, where I said, maybe now as we're talking about workers, risks with COVID, maybe we can also talk about other workplace risks like breast cancer. And I talked about my study. But I don't know, although I follow some of the news outlets in the UK, I don't know if it would be parallel, although I suspect there are some parallels and I've seen some parallels. But I think part of the problem with this distinction, or a distinction that shouldn't be there between public health and worker health, is that it has to do again with what the women in my study talked about and what we all are probably well aware of, and which Jane alluded to and Helen alluded to, which is that we're living in a neoliberal capitalist era where profit is more important than people. And so the tendency then becomes to make the responsibility, the individual responsibility, and to decontextualize those places where we're at risk. So if we start talking about workers, well, we're of course then bringing out all kinds of other inequalities and lack of protections that we're facing as workers. So with COVID, it happens, with breast cancer, with asbestos. I mean, I think we see this pattern play out over and over and over again. And, you know, like Jane said, you know, the workers, we have, you know, as workers, we have a space to come from to talk about the experience of, you know, risks and exposures, and we do need to work together. And I think that there is power in that, because without that, I mean, we're all workers and we all, you know, face risks in different ways, but we're all workers of some kind. So yeah, I think I think it serves our neoliberal governments well to keep this distinction between public health and worker health when they really are one and the same. But if we do that, then what we say is certain people's health matters more than others. So that, I mean, that's just a lot of rambling thoughts, but that's what I thought about when you were saying that, Kathy.
Thanks, Jane. Helen, do you want to say anything?
Just because it kind of comes back to that in another life, I was a shiatsu practitioner and studied Eastern medicine. And there, you know, it's like everything impacts on everything and it's all connected. Whereas kind of with Western medicine, it's like you enter into this vacuum, like it's all kind of separate. So that's why I was kind of thinking, you know, you go to the doctor and I don't know how many times I've been and said, well, you know, I used to work here. This is what I did. I used to work in the microelectronics industry. I used to, and it's just like they look at you thinking, why are you telling me this, you know? And it's like, well, it's got a bearing on my health now, you know, and I think that's why I think it's really important that there needs to be some education in the medical establishment about this. I know there's occupational health specialists, but again, it seems to be all quite segregated, which in my mind, that diagram with all the interconnecting factors, that's what it's like in reality, really. I just wanted to answer briefly Robert's question about Black and ethnic minority women. There's been a lot of research in the US, but not so much here. So I think, I don't know, that's why I kind of mentioned it, because on the breast cancer websites it was kind of referred to, but there was no link to any research or anything. So I think there's a lot more information needed there, really.
Okay, thanks very much.
If I can just quickly speak to that too. Again, just a little bit of information. Helen's quite right. It's not, that information isn't well documented in a lot of places, including here in Canada. But one of the things that I have garnered from the research that I've read is that there are a number of risk factors that Black women tend to experience that maybe others of us don't. Often this is again an issue of environmental racism, the toxic facilities and urban life and manufacturing facilities. Black communities tend to be located near them, as do Indigenous communities. Also, I understand from reading studies that there are hair straightening products often that Black women use that contain certain chemicals that elevate their risk. And then of course, the underlying problem of, we live unfortunately in racist societies. And so you've got social demographic factors like poverty and lack of access to good food. And so all of these things I think are intersecting to increase the risk. And then of course, in the US, access to healthcare is a financial problem. And again, when you've got that intersection of poverty, that's an important thing. And it just brings to mind, there's a great documentary, I think I was mentioning to Helen actually, called There's Something in the Water. And it draws, those connections between exposures for, Black communities and Indigenous communities here in Canada in particular.
Thank you. That'd be great to share that video with people. Kit, would you like to speak? And then Helen McFarlane.
Yes, thank you, Janet, and thank you for also to both James and Helen for the really interesting presentations. And this is actually my first time on one of these hazard calls, so it's a great pleasure to join and be part. And just for the sake of introductions, my name's Kit, and I'm the Public Affairs Officer at Breast Cancer UK. And as a charity, we focus exclusively on the prevention of breast cancer, and that also includes addressing the environmental and lifestyle risk factors associated with the disease, including exposure to harmful chemicals. And I mean, I really have to say, I must relate to much of what has been said in the presentations. And we have for years been trying to influence cancer strategies, public health plans, to make sure that there is an explicit, first of all, recognition of the impacts of harmful chemicals on women's health and the nation's health as a whole. And I'd just be quite keen to ask both Jane and Helen on the occupational side of things. You know, I think, Jane, you referred to in your presentation about the need for policy measures, particularly on occupational exposure, and need to recognise primary prevention as a core part of cancer strategies. I was just interested to get your view on what specific measures you would anticipate, you call for public health bodies to introduce to address occupational exposure. Because I think here in the UK, we have a big issue right now with the responsibilities for regulating chemicals being across many different departments. And because of that, we don't see much action. And also we've benefited quite substantially from protections at an EU level. And obviously post-Brexit, we will not have those protections anymore, and we'll be reliant on policies at a UK level. So I'd be just interested in your thoughts on that. And also, I think, just to add one final point, in the post-Brexit environment, when it comes to chemicals management and the implications for vulnerable groups, it really strengthens the case for collaboration across any organizations that have an interest in this area, because the NGO and environment is much larger and has far more impact at an EU level, because they have a far greater approach to precaution, whereas in the UK it's far more accommodating of the economic needs rather than the public health and environmental needs. So I just wanted to throw that out there, but yeah, I'd be interested in your thoughts on the policy measures to tackle occupational exposure. Thanks very much.
Okay, thanks, Kit. Helen.
Thanks, Janet. This has been really, really interesting. Just so many different things all coming together and really making me think from the perspective of being a trade union rep and thinking about, the opportunities of making sure, as Jane Stewart was saying, about the importance of women's health being a negotiating and right front and center of that. But the other thing that's in my mind as well is the kind of medical model that we operate in. Well, I'm working in Scotland, but across the UK. So whilst medical students begin life all doing the same course while they're in their degree, from the moment they stop their degree and they start on their first training job, their foundation year one doctor's course, they have to select a particular part of medicine, and then they move on from that and on from that. And so by the time they become wedded into either public health as a direction of travel, or occupational health in a totally different direction of travel, the gulf gets bigger and bigger and bigger, and the possibility of trying to bring those two branches of medicine together at some level, I think is maybe one way towards helping when it comes to industrial level with trade unionists, that we're trying to bring that together in those negotiations. On a slightly positive note, and I'll get in touch, Kathy Jenkins, with yourself after this call, because I was in a meeting this morning at work, which was the first meeting of a national group around public health. And it's a specific policy document that has been developed across all 4 countries of the UK, which is for allied health professions public health framework. So it's specifically looking at how allied health professions, which includes people like diagnostic radiographers, it includes therapeutic radiographers, it would include physios and occupational therapists and dietitians and what have you. So the aim of the framework is to really challenge how everybody who works in those jobs can have a role to play in terms of public health. So the policy has been produced, which is the 4 nations policy, but the group I was at this morning is about each individual country has to develop its own implementation plan. So I think there's a chance for us to try and influence. That's one public health policy. It's not the overarching one that Kathy was speaking about, but I'm wondering at the implementation stage, if we can get something built into that that will specifically address occupational issues within that part of the public health. So I'd really value your input into that, Kathy, and maybe Janet yourself as well, in terms of just looking at that through the lens of occupational health. It's weird how segregated we all are in our own thinking as well, isn't it? That's what's this is making me really think about, you know, that yes, I'm a trade union rep on one level, and I'm a woman who is you know, engaging in the screening services, and it's that mix of bringing it, trying to make, this is what's make it done for me, bringing it all together. And thanks for the 3 speakers for helping me make those links in my own head. It seems so obvious, and yet it feels like a rocket science. So thanks for that.
Thanks, Helen. That was really good, and yeah, we valued that discussion with you about it. I mean, and you know, and I just think what's the good about this sort of environment is the mix of people that come on to these Zoom meetings. You know, the trade unionists, the health workers, you know, the people that are involved in the delivery of the service and that sort of thing. And it just brings an added dimension, really. The experts, you know, that we've got here tonight, that allows us to have that bit of a discussion amongst us where we'd not normally have it. You know, we'd be sort of siloed into all sorts of different thinking. And just before I bring the speakers back in, Mick had posted about the Hazards magazine, and there's some brilliant resources on the Hazard magazine. Helen used one of them in her presentation, the mapping one that was produced by the ITUC, but we've promoted that across reps, safety reps, and how important is something like that to show the effects of occupation on the cancers, you know, how it's causing the cancers. And so to do something specific perhaps on women might be really useful as well, that, you know, to sort of highlight all those issues that women's health is being affected by. So I bring you in, I don't know, Helen, Jane, who wants to go first? Nobody. Helen. Bring you in first.
Oh, okay, all right. Sorry. So, I mean, I think, like I said, there's kind of regulations in place at the moment, supposedly to protect workers, but they don't actually appear to be working. And, you know, this is evident from the number of breast cancer cases that we have, and other illnesses and diseases as well. And it's like it comes back all the time to me, is that there's certain level of focus inside the factory and what happens there, but once you go outside the factory, that, you know, that's somebody else's responsibility, and vice versa. So I think this cross-sectorial working really needs to happen at every level. And, you know, we've got here now the health and safety executive, the HSE, is going to be responsible for the new chemicals regulation after Brexit. They can hardly cope with their remit already, so I don't know how that's going to work. But if we try and be positive, we might see that it actually may work to influence each other, you know, in terms of, you know, the chemicals and the workplace and the environment been brought together under one roof. But I'm not a trade union rep. I don't know why the cost assessment doesn't work. I know, like I said, there's been I picked up on the issue with pregnancy and the fetus being exposed, you know, and the protections don't kick in for a couple of months and stuff, and that to me would be a worry, you know. But I think I would turn it over to the trade unionists here to answer that question, how they would envisage it working.
Okay. Jane Stewart first, and then Jane McArthur.
Yeah, well, I mean, I don't know. I mean, I think we do need to build risk assessments and cost assessments and all that, and the keep our eye on deregulation that will inevitably come in after Brexit. And in this thing I sent to you, the link I sent on the Women's Health, there's loads and loads of organisations that are listed in there that would help you as a resource guide. But I'm still trying to get my head around how I'm going to do this as a trade unionist. I've got a plan, but I'm not sure. So maybe I'll come back to you with a little bit of a resource or something to tell you how I'm going to map it out and how I'm going to start developing policy around it within our union.
Thanks, Jane. Jane, the other Jane.
Kit, I think it's a really great question you're asking, and for me, it always feels like the big question. And through the course of my work throughout my life, and then coming back to school to do this degree where I was specifically focused.
Sorry. Oops. Sorry, Jane.
Not
I've just
working.
unmuted
Oh,
you.
okay. Yeah. Was all of that not heard?
No.
It was all muted?
Yeah.
Okay, sorry. What I was saying was that, I feel like I need to go back to school again and take a master's in public health and a law degree, because there's, one of the things I've come to learn throughout my years working on these issues, and then through this degree and working with these women on this study, is that there's so much to understand in the language of our legal systems and our policies and our governmental structures and all of that. But just to say at a very broad level, last night I did a presentation for an organization in Quebec, Breast Cancer Action Montreal. And one of the things I said there was that the Canadian Environmental Protection Act, that's a breast cancer prevention policy. Environmental regulations, legislations, laws, these are breast cancer prevention policies. And I think it speaks to, the earlier point that Kathy was making, and that Helen just raised, is that these things are all interconnected. So if we're, trying to say I need a definitive breast cancer policy, I think we're missing the point about the fact that these exposures are occurring in all of these environments. I think what we need to do at a very broad level is we need the implementation of the precautionary principle. We've got a lot of knowledge about the kinds of exposures and the sites of exposures that the science suggests are associated with the development of breast cancer. And so when we are working under the premise that we need absolute proof before we will act, in the meantime, you have a whole bunch of women and men getting breast cancer and suffering from that and dying from it. If we flipped it over and said, until we know this doesn't cause harm, we're not going to use it, that's a breast cancer prevention policy. There's a lot of talk in North America about this idea of a Green New Deal, and built into all of that is this notion that we need to take cues from the first peoples of our lands and sustainability and stewardship of the lands. And that goes a long way to not using products and chemicals and producing things that are causing harm to the lands, which of course we live in and on. And so if we are adopting a mindset of not damaging the earth, we are also preventing breast cancer and all kinds of other diseases. So I think, again, that's where the collaboration needs to come in. I think, my study of that one group of women, and you all as, on the rest of you on here as trade unionists, your workplaces. And this is one of the problems I think that happens. We create this uncertainty. We wait till we have definitive proof, and we decide that certain people are experts and others don't know. And I think we need to elevate and validate the knowledge of the people who have that intimate knowledge of their workplaces. So what policies are needed? Well, I think we need a broad policy of precautionary principle. We need clean air policies. And sometimes we need specific ones, and the people who live and work in those spaces are probably the best ones to say what those policies ought to do and what they should reflect.
Thank you, Jane. I think that's excellent, and I think absolutely right. We've been talking in TUCAN, which is a trade union clean air network, about toxic use reduction, and Hilda, that's on the call, is looking at producing a document on it and trying to do more work to campaign around toxic use reduction, which is about looking at alternatives in our workplaces for all sorts of chemicals. And I think, you know, as part of that, it's certainly important, you know, the sorts of things that you're talking about. I think Pat wanted to speak. I don't know if there's anybody else. Yeah, okay, Michelle afterwards. You're on mute, Pat. Can't hear you. Oops. No. You're still on mute.
There we are.
Yep,
I've done it.
that's it.
Can I say it's been really interesting in this, because in Unison, especially in the Northern region, which I'm from, and I'm chair of Unison's Northern Region Women's Network, but I also work in the health. I work in the Mental Health Trust, and for the last couple of years, we've been highlighting and taking motions to our women's conference around health and safety. We took the first ever motion 3 years ago. We'd never ever taken a motion on health and safety for women to one of our conferences until then. I started my career as a health and safety rep 30 odd years ago. And I can remember, I know somebody said on here about predominantly men. I did my training with the TUC course I was the only woman on the course at that time. We've come a long way. We've got more. We've just done a campaign to get more women in the whole of Unison. In my region alone, we've managed to get over 80 odd people interested in being health and safety reps again. In my trust, because I went out campaigning and because I use health and safety in everything I do when I'm at work, we've managed to get 28 new reps, and 18 of them are women, which is a massive thing for one mental health trust. I fought about 15 years ago to get the right for us to audit all of our work areas. So now the union health and safety reps audit every single one of our wards, our community areas, everywhere on behalf of our staff, which is a massive thing to do, but we do it. And I can tell you now, since COVID's hit, we're out there now and we're working alongside, making sure that the COVID health risk assessments are in place and everything like that. I mean, it's a massive exercise, but what it has shown us, as you say, areas where predominantly breast cancer, the menopause, domestic abuse, sexual harassment at work, we've used them as tools to get women more actively involved, because people see it as a dry, dull, or legislation thing. And I think that's why we've managed to do an uptake on it. And also we worked with the trust, as you're talking about chemicals, to look at the kind of chemicals our domestics and catering staff were using. And they've withdrawn a lot of them. We've got COSH files in every work area, and everything chemical that comes in is all like a standard and you're not allowed to use. And they've actually reduced ones with like bleaches and harsh chemicals in. They've looked at other alternatives to use. So there are ways we can do things, you know, but I've learned a lot tonight on here, and I'm going to be taking some of that stuff back as well.
That's fantastic, Pat. Thank you so much for sharing that. And, you know, great to hear that you've got all those women safety reps. And, you know, health and safety is what we say is an important organising tool in our workplaces. Just a last question from Michelle.
Thanks very much for allowing me to speak. Can you hear me?
Yes.
Because I stumbled on the meeting, but it's very relevant to me. I had my first mammogram when I was 50 and found I had DCIS, and I chose to have a radical mastectomy. I'd lived in the Lake District, and on the day that the Chernobyl cloud, you know, came over, I was walking the whole day with my family, including my daughter, in the fells, and we were drinking from the becks. And subsequent years, there seemed to be a cluster of cancers, with men more esophageal cancer, but breast cancers in that Lowes water in the area in Cockermouth. That's one thing. When my daughter was 35, she told me that she was going to have a mammogram. This is in Lancaster, because she found a lump. She had, and I said, well, don't forget to say that I had DCI, the mother had DCIS, and that your paternal grandmother died of breast cancer. Now, I divorced from my husband many years ago, and when Faye had her mammogram at age 35, she was just told you've got lumpy breasts, and your breast tissue is very dense, and it's you know, don't worry, nothing's wrong. So she said my mother had DCIS, my paternal grandmother died of breast cancer. And I was walking in the fells in Cumbria when the Chernobyl cloud came over. And oh no, that doesn't matter. That's nothing. You have to have at least 2 relatives on one side of the family to then have further investigation. What she didn't know, and I didn't know at the time, was that one of her great aunts had also died of breast cancer, because the questionnaire, it doesn't about you know, a history of breast cancer. Of course, it hasn't got anything about, do you know if your parents are divorced, if there's more. So that's sort of one thing really. Anyway, my daughter was my daughter 3 or 4 years later, she started to bleed from the nipples, and she then had a mammogram and was found to have invasive breast cancer. This was aged about 37, 38. So she had a radical mastectomy and an implant. A couple of years after that, she then noticed some scarring on little growth on her scar tissue. And I mean, she's got a science background, so she realised it wasn't right. So with a lot of pushing, she then was found again to have more breast cancer. I mean, it had come back, in other words. So all the cells hadn't been removed. So at that stage, all her glands, her axial glands were removed, and then later on, she had to have her ovaries and fallopian tubes removed as well.
Sorry, I'm going to have to. I'm so sorry. I'm going to have to hurry up because we're way past time.
Yeah, I'm sorry. Well, that's all I wanted to bring. That there should be a different questionnaire, and my daughter shouldn't have been fobbed off in Lancaster. Also, at one time, it said that there was a link between abortions and more chance of getting breast cancer, and then it went all quiet about that. And I just wondered if that was social engineering.
Okay.
Because you know,
let's put that to the speakers. Thanks so much, Michelle, for sharing. I'm really sorry all the trauma that you've been through in your family.
She's alive still.
But yeah, good. Yeah. That's great. Yeah.
Thank you.
So perhaps just the final word then with our speakers. So I don't know whether Jane Stewart first, because you were last. You need to unmute.
Well, yeah, I mean that's a very troublesome story, isn't it? But again, it's about not taking into account all of the factors, only looking at the genetic ones and not the environmental ones. And that's, you know, the medical profession just sticking to the boxes that they know. But I think, you know, going forward, I think we should continue to work on this campaign and type of agenda for women's health, particularly the breast cancer stuff, and link it into environments, both workplace and, you know, where you live and what you do, and also occupations as well, and the elements of poverty, which is no doubt connected to, you know, bad diet and bad housing and all that, are all sorts of predispositions for cancer, aren't they? So I think it needs to be definitely some social economic change that puts people before profits, and I'll just leave it at that.
Thanks, Jane. Helen, would you like to add anything?
Just thank you very much for this opportunity to talk about this, and just to say that we in the past had done quite a lot of work with Unison on breast cancer, and it was really great, and it could be used as a model for other unions as well, taking motions to national conference and allowing NGOs like me to speak at national conferences and do workshops was really good, and to speak to the different branches and regions, and that might be a kind of a model for how we kind of just kind of bring the two aspects together, if you like. But yeah, thank you very much for this opportunity, and really enjoyed it. Thank you.
And finally, Jane.
Yeah, I'm going to steal from Helen too and say thank you so much for including me in this. I learned a ton tonight, and I'm just so inspired and moved. And just to quickly respond to Michelle, when, you know, for me, stories are so powerful. I think are an overlooked piece of what we need to be doing in our work. And it just, you know, it occurs to me as you were talking and then thinking about what, you know, Jane and Helen have said tonight, and the things that we need to do. And maybe that's another project that the unions could take on, is to gather these stories. I just feel like the information that I got, the knowledge that was, you know, in the heads of all these women that I interviewed, and every one of us here, I mean, we have this tendency to write off certain people's knowledges and elevate others. And I think everyone here tonight has brought something important to the table. And I think it's a catalyst for moving forward with some, you know, fresh new ideas and energy and information. So thanks to everyone. And, you know, I'm hopeful.
Thanks, Jane. And it's been really, really smashing having you here all the way from Canada, even if it's virtually. And Helen from London, which is again virtually, and Jane from the Northwest. So thank you very much for the speakers for your fabulous contributions. And I'm sure you're going to really inform some of the work that we're going to do. So we're going to circulate the film recording. Thanks to the audience that's been here and the fabulous contributions that you've made and questions. And Hilda Palmer in the background doing lots of posting of links that we'll share afterwards. And we want to take this forward, you know, to suggestions. So take the suggestions forward, the actions forward. And perhaps what we're thinking of doing is to call a meeting of sort of significant people that want to be involved in it, and to see how we can then perhaps just, I don't say usurp trade union bureaucracy, but certainly enhance trade union bureaucracy, and see if we can start to stimulate some activity in the trade unions as a result of this tonight. So thank you ever so much for joining us and contributing, and hope to see you again on a future talk. Thank you. You can unmute yourselves if you want.
Thank you very much, Janet, again for a good session. Been to a couple of